A new medical school graduate must work 1 year in a hospital as an intern.
Okay, now push your back out like a cat.
Now the pictures in the books are real people. And now Karen Mack tries to treat them with her inexperienced hands. She is a doctor, but has to learn how to grow into her new role.
Sure, I worked hard to become a doctor, and I like it.
Dr. Mack knew that Philadelphia General Hospital was understaffed and in bad need of repair. But in spite of that, she chose it for her internship.
Yeah, Dr. Mack.
Here, she knew, each intern is given more responsibility than most interns in private hospitals.
Yes, he is.
At first, she didn't feel at all like a doctor. She thought.
Who, me?
Signs are still QID.
Gradually, her confidence and ability grew.
Do you have any more pains in your chest?
Many of the 8,000 interns in the country are given scut work by doctors. Routine jobs like taking blood, inserting needles. But here, interns are directly involved with the patients and discuss the cases every morning at Dr. Schnabel's staff conference. Here, they develop judgment. Something as important to a doctor as dexterity with his hands.
She's had a 12-year history of psychiatric problems with multiple breakdowns where she'd become hallucinatory and repetitive, acting very strange and incoherent. However, her younger kids came home from school yesterday, about 3 o'clock, found her asleep. But about 10 o'clock at night, she hadn't moved. They tried to wake her up, found they couldn't. So they called the rescue squad and they brought her in. Got a chest x-ray on her. Which isn't the greatest. It was taken supine down in the x-ray department. Sort of diffusely hazy and not a very good inspiration.
The right diaphragm looks a little high, but is she better now? Is she awake?
Yes.
Okay. Any other things to report this morning?
During her intern year, Dr. Mack had to perform the very job she was learning, and on patients with serious, sometimes fatal diseases like cancer. She soon realized that people's lives depended on how well she learned. Dr. Mark Ebel was an intern last year. This year, he is a resident doctor specializing in medicine and accompanies Dr. Mack on most rounds. This woman is only 35. Alcoholism has taken its toll. There's little left of her liver. She throws up a lot and is usually comatose. All they could do was keep her comfortable. 10 days later, she died.
Oh, yes. Is she getting any mail off?
Yeah, down the tube, except the tube's plugged up right now, so. Can we put it in the refrigerator? 9. 7. Miss Dodson? You got a cold?
As in many older hospitals, there are many problems. Paint peels off the walls. They are understaffed with people and overstaffed with mice.
I once asked the patient if she'd like a sleeping pill. She said, no, that's okay. I watch the mice run around all night.
Every new doctor hopes he'll accomplish dramatic cures. But Dr. Mack soon learned how important even an intern's routine duties are.
She went home, but at home she developed a lot more ascites in her.
The 90-hour work week brings physical strain and irregular sleep. But also, as Dr. Mack said, a deeper respect for life. And the rewards of seeing people get better. Every third weekend, she worked all weekend long. from Saturday morning till Monday night. An exhausting yet exhilarating year.
I was so tired at night that I just ate supper and went to bed.
The experienced nurses helped a lot. One taught her how to bear the daily burdens more lightly.
Many questions about Mrs. Barr. I don't think we're going to accomplish anything, so maybe it's being...
Another had a good deal of knowledge.
She's eating a lot more than 1,600 for her size. A lot more.
Not all the problems were medical.
Good morning, Agnes.
Good morning.
How are you today? How do you...
All right.
What's the trouble? What's the trouble? They feeding you right?
No,
Why not?
because I haven't had any food at all.
Since when?
When was the last time you had something to eat? Did you have breakfast this morning?
No,
Did you have supper last night?
no,
Did you have lunch yesterday?
no,
You must be pretty hungry.
I'm starved.
The problem is that she just has no place to go. Her chemistry is fine, her lungs are fine, her heart's in good shape, but she has a problem remembering things, and she can't really be on her own. It's just a little old lady with no place to go, and it's so common here.
I want you to just keep licking your lips, and eventually you're going to taste a real bitter taste.
This woman had heart trouble. Dr.
The taste-
Ebel
and the
conducts a
taste goes away
test.
very quickly, so
A Decalin injection to time the circulation through her heart.
say when.
Now,
Okay.
now lick your lips.
Normally, the bitter taste takes 16 seconds to reach the mouth.
As soon as you taste something, you just keep licking.
20 seconds, exactly.
As it tastes.
This test helped confirm what they suspected.
She has cardiovascular disease.
Another patient has lung cancer. Her lungs are full of fluid, and this makes it difficult to breathe. One cancer specialist is consulted.
Now, I don't recall from her film how large her mass is with a fluid in there, but it's optimal to drain it as dry as possible. We often put in an inner cath and keep it in over a couple of days and let it drain as
Then
dry as
another.
possible.
The first thing I would really try to do is give her something that will relieve her pain. The radiation didn't get rid of all her disease in her chest at all in the beginning, so I'm sure she's got residual disease.
How do you feel? My thought yesterday was to try and get all the fluid out and then give her something like some 5-FU and plaster.
So I numbed her back, inserted a large needle into her chest cavity, and drew off 2 quarts of liquid.
Robert!
Dr. Mack spent the year in several different wards in the hospital. The month on emergency ward duty, she handled about 12 drug overdoses. With this critical one, they had to work fast. A tube was inserted into his stomach to pump out any pills he may have swallowed.
Robert!
They took blood samples and inserted an intravenous catheter to give fluids to flush out his kidneys. Once, he stopped breathing.
They're in here. I got this.
What are you drawing your blood from?
I noticed needle marks on his arm and injected naline to counteract the heroin. I thought how bad he must have felt to do this to himself, but I didn't show it.
Her responsibility as a doctor was to save him and get him out of the hospital.
His pupils weren't reactive. His respiration started going up pretty quickly. So we gave him some bicarb, and they're better now. He's pretty rammy.
How about his eyes? He didn't have, his pupils went down.
His pupils were down. They were contracted, and they didn't respond to light. And now at one point, he stopped breathing.
He survived. But as she said, her satisfaction on helping to save him was spoiled by the thought of the temptations he would return to. She was so busy, Christmas seemed to come suddenly that year.
David in the water, David in the sunbeam. Sunbeam, I think that's a beautiful color. Isn't that pretty, that tree?
Despite the harsh conditions, or maybe because of them, the staff at Philadelphia General Hospital has a good deal of spirit and human concern.
You don't have to do that. Too much.
Having a good time, Agnes?
No. How could I have a good time when I haven't had anything to eat?
Oh, you haven't had anything to eat at all?
No, nothing.
Hi. Thank you. What should I do with it? Put it around you?
I think it's there first.
Okay. Is it your birthday today?
No, February.
Whose birthday is it today? It's somebody's birthday.
Happy birthday to you. Happy birthday, dear Simmons. Happy birthday to you.
Here we are.
Oh, I'm not going to give him any cake.
These parties help relieve the staff's own tensions as well as benefiting the lady's loneliness.
I haven't completely given up on obstetrics, but I just didn't think I could handle the hours.
More enjoyable than medicine in some respects.
True. Did you tell Mrs. Simmons happy birthday?
No, I didn't.
This is Mrs. Simmons. Agnes?
Happy birthday.
Same to you.
Like most big city hospitals, Philadelphia General needs more staff. When the mayor threatened to lay off 500 workers, it was time to protest. Interns and residents went down to City Hall. Soon, the press gathered. The mayor refused to talk to them, but Dr. Mack got on TV.
We just cannot continue to practice medicine as physicians at PGH under the conditions that they exist at the moment. It's just intolerable. People who come to PGH don't suffer with one disease, they usually have 10 diseases and need a great deal of care.
You were terrific.
They cut out the hardcore stuff where I said that the people who are in power are sitting out in the suburbs and don't know what's going on in here, and the people who come here don't have any power. They cut that out.
Dr. Mack likes to cook. French gourmet cooking especially, she says. For most of her intern year, she didn't have a date, but would invite friends over for dinner every 6 weeks or so.
Aren't you glad you have a female intern now?
I'm beginning to like it.
She tries, she says, to get a good mix of interesting people. Artists, lawyers, writers, as well as doctors. The conversation is always lively. This evening, they talked about her television appearance.
The press came, and then somebody came up to me and said, oh, I always wanted to interview a nurse. I said, well, I have to look for somebody else. I'm a doctor.
Karen's dinner.
To many more of Karen's dinner.
Right now, you probably...
She spent 1 month of her intern year in obstetrics. This girl was only 17, frightened and alone in a strange hospital, and about to have her first baby.
Take a deep breath. Push down.
During her pregnancy, she had never seen a doctor. Her apprehension makes the pain even worse. Dr. Mack has already delivered 70 babies and can give the girl comfort.
Oh boy.
Push. That's it.
Ay, mamita.
Don't scream. Push. You gotta do it on your own.
Ay, why? Ay. Ay.
Now contractions are coming every 3 minutes.
Okay, come on. You got a good pain. Push. Push long and hard. Come on.
Okay.
Okay.
Ah!
The microphone amplifies the baby's heartbeat, so Dr. Mack can hear if the baby is in any distress. The heart is pumping well. With the contractions coming every minute, the anesthetist and the obstetrician arrive.
Push. Keep pushing. Keep pushing. Push more.
I can't push
Push.
anymore.
Push. Good girl. That's good. Push. Okay. You're doing well, dear.
First deliveries are usually difficult, and with this girl, who's had no preparation for childbirth, they are concerned about the baby's life. Three hours after she was admitted to the hospital, they prepare her for the actual delivery.
I see black hair. Laura, come on, wake up and push your baby out. Come on, the test's right down here. Push
She's not
on.
contracting. Wait.
Not having contractions?
Wait for the pain. Just breathe again.
Ay.
Okay. Push.
And take a deep breath and push. That's good. Push. Okay. Go ahead. Push.
Got a big head. Okay, shoulders are out. Here comes the baby. Here comes the baby, and you have a baby boy. How about that? That's what you wanted, huh?
Yeah.